Hello, everybody, and welcome to my new live on chronic pain. Do you know the situation when you sit at the doctor's office and you tell him about your suffering, and you can see in his eyes he doesn't believe you, or he has this little disrespectful frown in his face, and suddenly he starts speaking about other stuff, asking you other questions? This is something that I hear a lot from my patients, and it's actually something that I experience myself while in pain treatment. While there were very good and great, empathetic, and nice doctors and therapists, there were also those where you just felt like, okay, everything I just said seems to him that I imagine the stuff or I make it up. I exaggerate. I just go over the top and nobody wants to hear it. And in these cases, isn't it that you don't feel seen, that you don't feel understood, right? And this, I think, happens far too often. So the theme for today is why your report of pain should be respected. Please feel free, as always, to ask questions. Just write them in the comments. Leave me a comment. I'm happy about that. And give me a thumbs up if you feel you can relate to the things I'm telling you here. Okay. I'm Gideon. I'm the founder of PAIN.PAUSE.LIVE, and I'm a psychologist. I'm a licensed psychotherapist in Germany, and I'm a pain patient myself. I have been a pain patient since 28 years by now, 27 years, something like that. And I think that's far too long, but you don't get to choose it. It just comes. Nobody chooses to have pain. Okay. Now, for the first part of my lives, I chose as a red thread to go through the definition of pain by the International Association for the Study of Pain, because they are worldwide the experts. And I think in this definition is nearly everything that reflects a new understanding of pain, and especially of chronic pain. And so I show you the revised edition from 2021 of the IASP. And we started out with a general definition, and then we went on that pain is a personal experience. It's just a subjective experience. And this is sometimes hard for others to understand, even for ourselves, I guess, often enough. And then we talked about the concept of pain, that it is learned, which is an unusual view or point of view on pain, though most people think it's just something happening in your body. But I talked about it. It's way more. You can look it up in my lives. You can find them on YouTube or in Facebook. And today it's the report of pain should be respected. And this is all part of the original definition by the International Association of Pain. Okay? They explicitly said the report of pain should be respected. And of course, as patients, we think, oh, yeah, of course it should be respected, because everybody wants to be respected. Everybody wants to be treated nicely. Everybody wants to be understood and seen, right? So why did they put it in? I think it's what I said earlier, that often enough, exactly this point is missed. But it's so important. Today's going to be a little bit shorter than the last days, but nevertheless, it's going to be very important what I tell you. First of all, we have to see that pain is never, really never imagined. There is no such thing as an imagined pain. Okay? So even if people from the outside tell you, oh, what I see here on the X-ray or MRI, it can't be that bad, what you feel. No, that's wrong. It can be. And even if they don't see anything and everything is healed, it can be horrible, can't it? I mean, we're our own expert. We are our own instruments to measure what the pain is right now. And the pain is influenced by so many things. This I talked about really excessively in the last video, so I'm going to spare you this one today. So there is no imagined pain. And if you have this in the back of your head, it's clear that every report of pain should be respected. No matter how dramatic it sounds for me as a therapist or doctor, I should respect it. Because that's the subjective truth of the person sitting in front of me. And this is so, so important. And here comes the second reason why it is important. And we get our slides back up. It's a really new study. I mean, it's like out of the press right now. That's done where they looked at what are the factors that really move the outcome needle to a positive outcome when we talk about pain therapy. And what they looked at was the different things that people do, therapists and physicians do to treat the pain itself. And they looked at the empathy. And then you can statistically calculate how big is the part each thing they do or how they behave plays in the outcome. And this is really interesting. We call it mediator analysis. But you don't have to remember that. It's just so you heard the word they use for it. You know, what mediates the outcome? And the interesting thing in this study is that actually the physician's empathy was the strongest predictor for a positive outcome in the end. And it was stronger than anything that was done in pain therapy. So this is one more reason why it's so important to find someone you trust, a doctor you trust, who is empathetic, who is compassionate, and all this. Of course, they should do a good therapy. Yeah. But, you know, I always think well, I take this for granted. If I go to someone who's specialized, I want to get a good treatment. But what's really important is how our interaction is and how I feel seen and how I feel understood. And we see here clearly from the data in this study that empathy and compassion play a bigger role than anything I can do technically. So, to wrap all this up, for you, it's very important to understand that pain is never imagined. This is the first thing. Don't fall for this. Don't get insecure. Think you got something wrong inside of you and you doubt yourself because you shouldn't have that pain. Oh, if there's pain, there is pain, no matter if I see something on the x ray or not, or on a blood test or not. If I have pain, then there is pain. The next thing is, if it's possible, see that you get a physician that's compassionate, who you can trust, and you can talk about things. And I know there are time limits and everything that drives the private practice of these doctors, and also my practice as a psychotherapist. But it's so important to find someone you can trust, because these are the people who respect your report of pain. Okay. And that's about all for today. I promised you it's going to be short, and yes, it is. And if you're interested in getting some help through the jungle of pain therapy, there's a PDF you can download. You find it in the notes in the description of the video, and just afterwards in the top of the comments. It's free to download, and it's meant as a help for you to navigate the waters of pain therapy. Okay, tomorrow I'll be back with the next thing. We talk about the biopsychosocial model. Whoa, I was about to forget my own my own expertise. Whoa. We talk about the biopsychosocial model of pain tomorrow, because this is also very important to consider. See you tomorrow. I'm happy you're here, and I wish you a wonderful step back into life. Bye.